I joined the MND team here 18 months ago. I had previously worked with MND and in neurology. However, it was the MND that really struck me. I really enjoyed, as sad as it can be, working with this patient group. So when this job came up, I jumped at it, thankfully got it, and it has been brilliant. The team are amazing. It's a massive team who work so well together, and it's such I think for our patients it makes a huge difference that we do work very holistically and very collaboratively, because we are able to be a sort of one-stop shop for them. So even if it's not a question that's meant for me, I have patients who will just ring me and say, oh, I've got a problem with I'm falling around the house, you know, what would you suggest? It's okay, I'll contact OT, the occupational therapist, and the physiotherapist. They can come and assess your home, they can have a look at adaptations. So I think it means for the patients and their families, they're not ringing around various people. They can just, if they've built up a relationship with one person, they can just come to that one person, and I have several families who do that. Initially after diagnosis, the patients were brought to the clinic where they meet the full multidisciplinary team. Depending on which subtype of motor neuron disease they've been diagnosed with, they may or may not need to see me. If they have been diagnosed with progressive bulbar palsy, we know essentially what pathway they're going to take, and they will need dietetic input. So from that point, I will meet the patient, have a chat to them about where they are currently. Do they have any swallowing issues? I do my clinic in joint partnership with the speech and language therapists, so we're able to work together collaboratively to give the patient the best start, really. I would say probably the biggest part of my role is listening to the patient. So although there is the clinical side that we have to look at, i.e. what subtype are they diagnosed with, we may have advice based around that, but it really does boil down to what does the patient want. We can give them all of this advice, but it is about listening to them, making sure they're well informed, making sure they have all the necessary information to be able to make decisions based around their care. I'd really encourage you to donate to the Leeds Charities MND Centre, because it will make a huge difference not only to the staff working there, it will make our working lives so much easier, so much more accessible for us and our patients, but primarily for the patients to be able to come somewhere where it's not intimidating. The main factor I'm looking for is somewhere that's really welcoming to all of the family members. So we do have more family members, more patients that are being diagnosed earlier, and therefore they have younger children. The setup we have at the moment really doesn't cater for family members. From my job perspective, I would like to have an area whereby I can have access to some supplements to allow the patients to try them when they come into clinic.